can have these three types: reading for the main idea, you can have reading for detail, or you can have reading for purpose. So the question type that we are going to discuss today is reading for purpose. You can see here it says reading workplace communication to understand purpose. Now, what are the common types of documents that you get in the reading part B section? Is you mainly get workplace related communication, which could be an email or a memo or a notice. So in the purpose question, you are asked or you are expected to understand why that is written, or what the readers are supposed to do after receiving it. For example, if the nurse in a pediatric department of a hospital receives an email, it describes an incident surrounding, and maybe an adverse event that might have happened. And then it tells them how, the event occurred and because of what it occurred. And then it may give you some information about what are the additional precautions that they may need to take to make sure that this kind of incident doesn't happen again. So what would happen usually is, um, you know, they will, the purpose questions or the documents that are written for purpose will always have two sections of information. One section would be the background. They would explain the background. They would, give a rationale behind a change. And then they would also give information about what is the update. So the main purpose 99% of the time would be about the update, and the background information would be just used to set the context for it so that the staff is able to understand in what context these changes have been made or why these changes have been made. So if you keep this thing in mind, it would be very easy to deal with purpose questions. You need to keep this in mind. You are not supposed to get taken away by the background information that is given there. You should always ask yourself, why is it given? Or what are they supposed to do after receiving this email or after receiving this memo or guideline? So what are we going to do first is we are going to do this short activity. And after this activity, we are going to deal with reading part B specific questions. So if you can see it on screen, you have communication type, you have the purpose here. Now, if you can see the first one, it says the nurses working in the surgical team, they receive a memo. So memo is usually used to remind something about a proposed change in the concerned taking and where they can assess the information. So there has been a change in the consent taking, and that is why the memo is being sent. So I've done this already for you. It is to prepare them for a future update, because now there has been a change in the guideline that the procedure of taking consent from the patient has been changed in a certain way. So this memo is preparing the staff for future change. Now what I want you to do is, for question number 2 to 5, I want you to select A, C, D or E, which one is appropriate option. Okay. You need to type in your answers in the chat box. Reading the communication type or reading this communication, you have to decide why is this communication being done? What is the purpose of it? Type your answers in the chat box so I get to know if you're able to understand the concept clearly. This will be very, very helpful when we would start practicing the actual questions. So for the second one, it says it is surgeons who are getting the email, which is summarizing the main points from the meeting about reducing surgical site infection. And it ends with action point. Okay, so it has an action point in it, which means it does give information about what is to be done. So here it says it is an email and it ends with an action point, and it concludes the points of a recent meeting on guidelines. That means this part indicates some new updates, isn't it? This is not about uh, something which is existing, because they had a recent meeting, and as a result of that there are some actions which have been added. So D is not the correct answer, because D says reminding to follow a guideline. This is not a reminder. Yeah, it's an email on the update. So that's C, reducing the rate of complication after surgery. That's the purpose, because it gives them an action point. It tells them what to do. And what is the context here? It is in relation to the guidelines related to reducing surgical site infection. So 2 is C, not D. Then nurses, they see a notice about the troubleshooting. It says troubleshooting while using a defibrillator following a recent problem. Yeah. So troubleshooting is mainly when you are working with a technology and when you have an issue. Just now, just the way I had issues today in starting the session and getting into the session and sharing the screen and those kind of things. So that's troubleshooting. So here E is the correct answer for third one. Yeah, that's right. E, giving information about what to do when equipment is not functioning. Then physiotherapists get an email informing them about low stock of something, and it also gives them the way in which they can manage it, what they can do until the new stock comes in. So it deals with two aspects: informing about low stock, and it also gives advice on how to deal with it. So it is alternatives. Yeah, it's alternatives, requesting for the alternatives. True. And fifth one, nurse get a memo about a large number of post-operative cases. And then it says here that the memo is asking them to follow stringent glucose control. So again, it is not introducing a new action plan or not a new guideline, yeah, but it is a memo. So memo is most of the time a gentle, may not be a gentle one, but yeah, maybe a warning or a reminder to the procedure. So yeah, that's correct. It is reminding them to follow a guideline. So fifth is D here. Yeah. So I'm repeating. Second one is C. Third one is E. Fourth is A, alternatives, and fifth is E. So how do we go about it? Now let us do more OET specific question types after once you have understood the concept. When you look at purpose questions, again, as I discussed here, the verbs are very, very important. Okay, reminding, preparing, reducing, giving information. So if you pay attention to the verbs, it could be very, very easy for you to differentiate between the answer choices. So whenever you are dealing with purpose questions, be very, very careful with the verbs that you have in the answer choice. They can make a real difference in the way you approach the answer choices. So now let us look at one such question, right? So what I'm going to do is I'm just going to get the question and the text on screen, because whenever you are dealing with reading part B questions, how you should approach it is you should always read the question first. The question will tell you what you have to do, right? So you have this three-step strategy to deal with reading part B questions. The first thing you do is you read the question, and while you read the question, you try to find out what I have to do. So this can be three ways. You can be reading for main idea, you can be reading for detail, and for this you should be able to identify what kind of question you are dealing with. Okay? So read for detail, it could be, or it could be reading for purpose. So whenever we do the session, we do it in a way where we are doing one such type of questions so that it becomes easier for you to get acquainted with that particular question type. So the first thing you do is you read the question prompt and you try and find out what you have to do. Do you have to read for main idea, for detail, or for purpose? So in this question, which we are looking at, it says the purpose of this email is to. It says the purpose, which means I have to read for purpose. Then second question that I ask myself is, who is it for? Now, when I'm trying to answer this question, who is it for? Okay, I would try and answer it from two perspectives. Which group of staff and I would also try and answer this question. For which group of patients? This is very, very important because sometimes the extracts will be written for a specific category of patients, whereas other times they may be written for all the patients generally. So it's very, very important to identify which group of staff is it for and which group of patient is it for. And the third thing you do is you try and find out why is it written? What are they supposed to do after receiving this? Why is it written? Is it written to remind them about something? Is it written to inform them about something? Is it written to warn them, to instruct them? What are they supposed to do after receiving this? Okay, so what you do is to find out answer for this question, you read the question. But to answer these two questions, you will need to read the text. Now, the main challenge in reading part B is if you had enough time, it is easy. You can read the question two, 3 times and answer choices 2, 3 times and you get the answer. But then it would not be the right technique to deal with those questions because it could be very time consuming and you may not be left with enough time for reading part C. How the reading test is designed is where you get combiningly for for 16 questions of reading part C and 6 here, so a total of 22 questions, and for that you get 45 minutes time. So, and what happens is the questions in reading part B are easier. The questions in reading part B are easier and you don't actually need to read them 2, 3 times if you know the right technique. So ideally you should be able to complete all the questions of reading part B in no more than 10 minutes. Now this can be done only if you read the text once only. So this is the reason why it's important to follow the right technique. Because if you have the right technique, you wouldn't need to read the text, multiple times. Without having to read it multiple times, you would be able to answer those questions. So what are we going to do next is I'm going to get the text again on screen. And I want you to answer these two questions. I want you to type in the chat box or type in the comment. Who is it written for? Is it for a specific group of staff? Is it for a specific group of patients? And why is it written? Who is it for and why is it written? So you can see here the heading will give you a straight away answer for uh, who is it for. So it says all surgical team members. And the subject is refusal of marking. Now read the text and find out, is it for a specific category of patient or is it generally for all the patients? And find out why is it written. Why is it written? Can you answer that question? It says a recent incident involving a patient who refused surgical site marking. So it's again not for a specific category of patient. If you read the whole paragraph, it's generally about all the patients who are about to have the surgery. But if they refuse to have surgical site marking prior to the operation, which is uh, it says a recent incident involving a patient refused surgical site marking has prompted an addition in the standard operating procedures. Yeah, what exactly? Yeah. So it tells us what should we do. But if you see here, it also gives you an idea that there has already been a standard operating procedure. So this is not for the first time probably that they have developed a guideline. Yeah, but they have added a few points probably. That is why it says a recent incident involving a patient who refused surgical site marking has prompted an addition in the standard operating procedure for such incidents. Means the procedure was already there, but they have added something. Similarly, they have said that the patient has the right to refuse. The response on healthcare staff on duty should be no different than any other situation where patients refuse care, treatment, or services. That means our approach towards the patient should not change. Now, they have said in such case what they should do, like it mainly gives information about what they should do. The first step is that they should inform the patient, okay? Then the second step is that they should inform about the consequences. Then they should also keep in mind that they cannot cancel a procedure just because the patient has refused marking. And it also tells them that there is already a provision in the preoperative verification checklist to document such incidents. But now they have added one more thing, that it must also be documented in patient's file, right? So basically, this is giving them information about what to do when a patient refuses marking of the surgical site. They already had certain protocols, but here they are adding a few more points to it. Now let us look at the answer choices, and this I'm sure will be very easy for you to pick up if you have understood the concept correctly. Again, when you are dealing with purpose questions, as I told you, pay attention to the verb explain, remind, inform. Now, remind. Yes, remind means the procedure was already there, but staff didn't follow. So then in that situations, it can be reminder. But here they have said that they have added a few more steps. So this is not a reminder for sure. Now I have two options, a change in practice or inform them that they need to complete an extra step in the process. So now tell me guys whether it is a change or an extra step. Is this document giving information about a change or is it giving information about an extra step that needs to be taken by the healthcare staff? Yeah, everyone is saying C. That's great. Yeah, so C is the correct answer. It does give, yeah, extra step. Yeah, because it says in addition to the existing procedure, in addition to what they have already been doing. So two prompts you got here. In the beginning also it says that because of a recent incident, there has been an addition in the standard operating procedure. And here also they have mentioned that it is a new step that has been added. It wasn't there before. So that's great. This tells me that you have understood the concept clearly. Now let us do one more question. let us follow the 3-step strategy. You can see the question here. You can see the text as well as the answer choices. The first step in our strategy is to read the question. What is the purpose of the notice? Always also pay attention to what kind of document are you reading, right? Because depending on what kind of document it is, you can make out what kind of information would be there. So this is a notice about use of language in emergency rooms. What is the purpose? You have to find out why this notice is being sent. It is about use of language in the emergency room. Now read the text with those 2 questions in your mind. Who is it for? Which group of staff? And is it for a specific group of patients or not? And third is, why is it written? Why is it written is the most important thing to find out. Why is it written? Can anyone answer that? First, they have set a background as to, the language has taken creative direction lately. So first, they've explained what has been happening. Yeah. So here it is about the to the whole staff of emergency department. Why is it written? So it says here that um, you know they have been using a lot of non-standard abbreviations and a lot of colloquial language, and then they have warned here use of such language can cause confusion and may mislead attending physicians and thereby increasing the likelihood of error. So look at the language here. It is more of a warning. It hasn't been happening already. Yeah, because that is why they have used the word it can cause. There is a possibility it may mislead and it may increase the of error likelihood of error. So yeah, exactly. So here if you look at the answer choice, it says to respond. Yeah, so as I told you, verbs are very very important here. To respond, that means unacceptable number of errors have already happened and the administration is trying to respond to it. No, the language here in the uh, paragraph is more of a probability language. It says it could happen in the future, it may happen in the future, and because of that the patients can be under unacceptable level of risk. It could increase the risk and therefore it guides them. Please use correct and acceptable terminology. So why is it written? It is written to tell them that what may happen because of using colloquial language, what may happen. It is not happening already, but it could happen. So that is why to prevent potential miscommunication. Potential means something which can happen, likely, something which is going to happen in the future or which may, probably happen in the future. That's potential miscommunication amongst staff. That is the purpose, to prevent it, because they have mentioned clearly that please use correct and accepted terminology. So to prevent miscommunication, because this kind of language can cause confusion and it may mislead the staff. So C is the correct answer here. Okay. And to respond why it is wrong is because the errors have not yet happened. The text is not, saying that there have been many errors happening. They have mentioned that it has come to our attention from several emergency rooms. But that is about the type of language, not about the errors that have already happened. So this is how you choose the answer. And again, it is to pass on complaints from service users. Again, it is not about the complaints have not yet been received. The problem hasn't occurred already. They are worried that in future it may occur if this kind of language is used. So that is why prevent potential miscommunication amongst staff, right? So by following this three-step strategy, it would be very easy for you to quickly get the answer without having to read the text twice or thrice. Now what I'm going to do is, for the next question, I'm going to give you 2 minutes time, and within that 2 minutes time, you should be able to answer the question. Make sure that you are following the strategy that you have just learned. Okay, so you have the text question and answer choices, and you have 2 minutes time. Go ahead. We are going to do all the purpose questions today so that you get the strategy correct. Type your answers in the chat box so that we get to know. You have 20 more seconds. So that's time up. Yeah. So right, B is the correct answer here, because you can see it says it's mainly written for pediatric patients, and it's given here that it is for the practitioner or the doctor who is involved in the discharge process, because it gives you information here that clinicians should also document. So it is mainly for the clinicians who are involved in the discharge procedure. Why is it written? So here it says, it is a policy of this hospital that upon the child's discharge from the unit, all parents receive written discharge advice about their child's hospital stay. So this is mainly written to inform them about the policy. Yeah, so here it says it aims to, it's not to inform but to ensure that they follow the policy. So the policy is to provide written discharge advice. Then they have given some information as to how they can provide it. So they are supposed to use this ADT navigator, and it can be also printed if it is necessary. What information should they include in that? And it should be written in a way which is not causing any confusion. So this is basically written to tell the clinicians as to how they are supposed to ensure that the family or the parents are aware about the discharge arrangements. So you can see here appropriate software to use for discharges. You can see here they have mentioned the software. Yeah, but the purpose of this text is not to mention just which software is to be used. It's mainly about how important it is to give the discharge summary and advice, and they have also mentioned what all things are to be included in that. Okay, and here also, if you can see, the role of the clinician in discharge. So sometimes what may happen is the answer choices in the reading part B will be wrong because sometimes they are too specific. When I say too specific, which means they only deal with one aspect of the text. So the text does talk about a software to be used, but the whole text purpose is not just the software. Similarly, some answer choices can be too general. So here it says role of a clinician in discharge. Now, if you talk about role of a clinician in discharge, it is a very vast topic, isn't it? Apart from providing information to the patient or the parent, the clinician must be doing other things as well. So the purpose here is not just to kind of, tell them about the software, and at the same time this is not about everything that needs to be done at the time of discharge. It only refers to giving advice to the parents. So any answer choices that are too specific or too general are wrong. So that is another way in which you can rule out wrong answer choices. Okay, next question. We are going to do 6 such questions. For first 3 questions, I'm going to give you 2 minutes. And for the next 3 questions, I'll be giving you 1.5 minutes time to answer the question so that you are able to keep up with the speed as well. Okay, so we have got third question here, and you have 2 minutes time to answer that as well. 2 minutes. Okay, that's 2 minutes. Okay, so I can see almost everyone again going with B here. And that's the correct answer, because you can see here the steps are listed, isn't it? It is the policy document about high alert medication. And if you see here, they have mentioned that they must be stored correctly, the names and strength must be checked, okay? And prior to administration, they must also prepare the dose correctly. So it is mainly about administration. And then they've explained that following this procedure will guarantee the safety, and it can also reduce the number of errors. So that's correct. B is the correct answer here. To obtain is to get them, to access them, but the text doesn't tell us from exactly where we can get them. Uh, C option says that correct dose has been prescribed, but the text mainly talks about the administration part of it rather than the prescription. Yeah, because if this was correct answer, if C was correct answer, correct dose has been prescribed, then the text would rather give information about what age of patients would need how much dosage, at what weight, how much dose would you give. So it's not about prescription, it's about administration of the medication. So excellent, everybody got the correct answer here. Okay, now let us try reducing the time taken for it, where you would be getting 1.5 minutes. And now what I'm going to do is, without interrupting your flow, I am giving you straight away 5 minutes time altogether for next three questions. And after 1.5 minutes, I would change the screen. Okay, and we'll discuss all three answers together. So I'm getting answer questions one by one on screen, and I would be having that question for 1.5 minutes. Go ahead. Remind yourself to follow the strategy. Who is it for? Why is it written? What will the staff do after receiving this? That's something is the focus in the purpose questions. So this is the final question for which you have 1.5 minutes. So that's time up. Now, what I'm going to do next is I'm going to ask each one of you to explain me what answer have you selected and why, right? So that would help me to get the concept check, whether you have been able to understand the concept or have you randomly checked the answer. You don't need to, it's okay if you type in, fair enough. So type in your answers and then I'm going to ask each one of you to explain one question as to why you chose that answer. So that gives me an insight into your thought process, how you looked at the question and how you, thought about it, how you answered that question. Okay. So in that case, I would ask Krishna you to explain me the answer for question number 4. Put your microphone on and just let us know how did you decide C as the correct answer.
First of I be ruled out because they only talk about a pediatrician, though they are not only about a pediatrician, they also about
Yes.
more than 65. The
So
first
who is
way
it for answered this question, right? Who is it for? This entire text is not just about pediatric patients. It is about all the high risk
all
patients. Yeah. Hmm. Okay.
and the A is I ruled out because they mention only the condition, weather condition forecast.
Hmm.
The main topic is not there
Hmm.
about that, and I choose C because they also say specifically advise when necessary.
Hmm.
They talk about psychiatric medication, and they also it is imperatively to discuss any such medication that the patient may have in the possession are required.
Yes, exactly. So the purpose of this is not to warn them only about the weather, forecast, because the main purpose here is to tell them that because of change in the weather, this complications are likely to happen, and therefore it is particularly important that the patients who are on psychotropic medications, for them you need to seek a specific advice either from, um, you know the physician or the pharmacist. So why is it written is mainly to make sure that the staff is getting advice where it is necessary. Another, way in which you can rule out other answer choices is B, as it is too specific. This entire text is not just about pediatric admissions, and again, it is not the overall purpose. They've mentioned that emergency admissions will increase, but that's not the purpose because this entire text is not written for ED staff. Is it written for the ED staff? No, because they have mentioned that if your patient are having any psychotropic medications, so it's not about the staff in the ED, right? But it is in fact to the staff in the resident care home, or staff in the retirement care home, or the staff in other residential care facility whose patients may be on psychotropic medication. So if they ensure uh, accurate management, then this ED admissions can be reduced, because they have mentioned that many things can be risk factors, serious health conditions. Okay, so there can be all these risk factors, but the main is the use of psychotropic medication needs particularly careful monitoring. And another, skill that we know, or another micro skill that you know, is whenever a sentence is written with although, right? So that the writer is trying to say that this is not the main idea. So although range of factors impact, so these are all the factors that impact, but this particular text is not about other factors. It is mainly about the patients on psychotropic medication. So wherever you come across a sentence with although, the second part of although is very, very important. Not something which is
Ma'am,
written.
here
Hmm.
I here used that one.
Hmm.
After
Yeah.
although sentence, I
Yeah.
focused on that thing. So
So that can be very helpful to pick up the main idea. So writer is trying to indicate that although all these are the risk factors, but here the main focus is on the patients with psychotropic medication. So here also it says when necessary. So when necessary is when the patients are on psychotropic medication. Right, so it is a combination of your macro skills and micro skills. Combiningly, you need to use your language skills as well as the test taking skills. Only then you can get the right answer. So I think all of you have chosen C here, so that's very good. And another reason why I could exclude A is it says exceptional weather condition. So one of the micro skill that we know is we pay attention to extreme words, right? Exceptional means this time it is going to be unusual. Whereas here they have mentioned it very clearly that in this country, summer regularly causes more fatality. So it is not that this time it is going to be an exceptional, every year it happens, right? So that's just very good. Now let us move on to the next question, fifth one. Yeah. So, Kishan, have you answered this question? I didn't see your answer in the chat box. Have you attempted this question? I can see your one answer in the text box. You have chosen C here. Okay. So, can you explain us how did you go about it?
Uh, fair, first of all,
Hmm.
who it is for? It's
Hmm.
for staff, operating room staff,
Yes. Yes.
and why it is written,
Hmm.
uh, because their protocol about the protocol about hand scrub.
Hmm. So are they introducing a new protocol, or are they
Nah,
changing the existing protocol?
uh, not new, but they in the last line they have added otherwise is unchanged, but
Hmm.
effectively reduce the time in the orthopedics 2 minutes.
Yes. Yeah. So it says that otherwise the entire protocol is unchanged. There is no change, but the only change is in the time,
Mm.
right? So in that case, I wouldn't select C as the answer, because C says refer to a set of new regulations. New regulations means they have developed new guidelines. Are they
Okay.
informing about any new guidelines here?
No, no.
No, right? So a set of new regulations means they are going to implement new guidelines for hand scrub. So C is not the correct answer here. And again, it says remind, right? So remember, whenever you are looking at purpose questions, pay attention to the verbs used. So here it says that they are a revised optimal surgical hand scrub. That means this is published for the first time. So it is not a reminder. Reminder means it was already there and now the staff is being reminded of the protocol. Here it is not a reminder because there is a change in the protocol and they are informing the staff of the change, right? So it is inform the staff of recent changes to the procedure because again it is not particular technique is not mentioned. The focus here is on the time for for how long it is to be done. So it says here that it is to be done it was to be done for 5 minutes, but now it is to be 3 minutes. So here, see, this sentence helps you understand this. A revised optimal surgical hand scrub time of 3 minutes has been introduced. So if it has been introduced recently, then it cannot be a reminder, right? So always when you are dealing with purpose questions, pay attention to the verbs that are given there and a set of new regulations, which means a new guideline, but that's not a new guideline. It's just the time that has been changed here. So correct answer here is A. Inform staff of recent changes to procedure. So there has been a change about in the time for how long they need to follow the hand scrub. So here, okay, both of you have got it correct, and Kishan, I suppose, is now able to understand. Now let us look at the third question. Okay, so here it is already in the question itself given that this is a reminder, right? Now we had to find out what is being reminded or what the staff is being reminded about. So Dr. Kathan, can you explain us here what answer have you selected and why?
Yes, ma'am. I have selected option B
Hmm.
because I have ruled out option A because there is nothing mentioned about accurate measurement of blood pressure.
Nothing mentioned
Nothing
about
mentioned about
measuring.
the measurement.
Hmm.
That they should accurately measure.
Hmm.
And also there is nothing mentioned about the procedure they have to follow in case of increased measurement, increased
Hmm.
morning.
Hmm.
They
Yeah.
only remind the staff that there is increased likelihood of blood pressure in the morning because of that morning urge. So
Yes.
nothing about the
Some of the
procedure to follow.
sentences that alert us is more frequent in the morning
Yes.
hours. Yeah. Hmm. Then they have explained the reasons because of physiological changes and biochemical changes and circadian rhythm it can happen. And then they have explained that because of that these patients can have cardiac events in the morning. And then this about the older hypertensive patient, it's just one of the example. The entire um, paragraph is not just about elderly people. It is about anyone who is having myocardial infarction, but they are more at risk. Older people have more risk as compared to the other group of people. So again, the answer choices are not specific to any category of patient. All of them are related to general category of patients with blood pressure. Yeah, and it tells us that because of certain reasons it can be high, but it doesn't go on to tell us what we should do because of it. Yeah, it doesn't give us any idea as to because of this we have to measure the blood pressure every morning, or whether we have to be more careful while measuring, or it doesn't tell us what should we do if the blood pressure is high. So that is helping me to rule out C, the procedure to follow in cases of increased morning blood pressure. The paragraph doesn't tell me anything about what should I do if the blood pressure is high, and the importance of accuracy in measuring. So the paragraph doesn't tell me what steps do I need to follow while measuring blood pressure, or it doesn't give me any guideline as to how can I ensure the accuracy of the blood pressure, or accuracy of the measurement that I've taken. Yeah, so that's how you are going to deal with reading part B text. Yeah, and that's what you need to practice even when you are doing it. It may happen in the beginning until you get your hands on it. You may find it difficult, but once you use this strategy and when you try to apply it when you are practicing from beginners or intermediate books, you would definitely be able to work out on this skill. And the target here is we are trying to get as many correct answers as we can. So probably getting 5 correct answer out of 6 would be a good standpoint to pass the B, pass the test with B level, because that's when you would be able to reach 30 or 32 mark. Okay, so now if you have any questions from what we did today. Okay, so if you don't have any questions, then I would remind you to do the reading part A text. I'll make sure that we have uploaded it by tonight, so make sure you have been doing it. And we would be then discussing if you have any questions from that particular test. Okay. If you don't have any further questions, then please let me know by typing all good. And if you have any questions, then please ask.